We are the SFP Bio team from I-Shou University in Taiwan. We are going to show you a nutrient-based fluorescent material which may give us an opportunity to improve our future. We used chemical reaction to synthesize a product from saccharide and amino acid. The compound was named as SFP. The SFP can glow by laser excitation. Evidences showed that treated cancer cells with SFP glows visibly. We also treated SFP in mice and monitored the metabolism effects. The data showed that SFP can be self-eliminated without any hazards. This technology has also received US patent and Taiwan patent. You may wonder how such a technology can help medical applications. You should be familiar with this technology, FDG-PET. Cancer cells require a great deal of sugar or glucose to have enough energy to grow. PET scanning utilizes a radioactive molecule that is similar to glucose called FDG. Our SFP is made by saccharide which accumulates within malignant cells because of their high rate of glucose metabolism. Our evidence strongly supported that SFP selectively uptake in cancer cells than in normal cells. Based on these concepts, we are confident that SFP can be applied in two directions. First, in vitro assay, it might be used for liquid biopsy and CTC's isolation. Second, in vivo, it might be used for angiography or even tumor guide surgery. Here is a simple animation that explains how we apply SFP to liquid biopsy. First, assume that there are residual cancer cells in the patient's blood. We collect blood from patients and use fecal pack to isolation of lymphocytes and monocytes from human peripheral blood. After we harvest the cells and treat them with SFP, the malignant cells uptake more SFP than the normal cells. We acquired a cell sorter to separate these cells based on the fluorescent intensity. The fluorescent positive cells collected here should be cancer cells, which can be cultured for the further examination, such as NGS, PDX model, or drug screening. On the other hand, the fluorescent negative cells collected here should be immune cells. These might be used for future treatment. Using the above-mentioned technologies may lead us to precision medicine that is more beneficial to us. Based on these concepts, our first indication patient is selected as leukemia patient. Minimal residual disease is the name given to small numbers of leukemic cells that remain in the person during treatment or after treatment when the patient is in remission. The concept of MRD, hypothetical scenarios of leukemia cell burden changes in response to therapy. The concept of MRD is built on the principle that the likelihood of tumor recurrence is related to the amount of residual tumor cells. For example, The red line presents patients with persistent disease can be adequately assessed by a microscopic assessment of the bone marrow. Consistently, the light green line presents patients with low-level MRD, and dark green line presents patients with lower-level MRD who got maximal therapeutic response. Most researchers today use multiple flow cytometry or NGS to examine the MRD. However, multiple flow and NGS can only do specific tests for specific diseases and cannot collect live cells. By using SFP in MRD testing, we can isolate the fluorescence positive cells. These cells can provide more information of the disease and connect to the precision medicine in future. There are several advantages of SFP in MRD testing. SFP can distinguish tumor cells from white blood cells within 2 hours. SFP is easy to operate, provides quantitative results quickly, and facilitates testing services. The specimen may be blood fluids such as blood or bone marrow. Sorting technology can collect living leukemia cells and can be used for personalized precision medicine. Here we provide 3 clinical test results. We isolated peripheral blood and bone marrow tests from clinical leukemia patients. The results show that SFP used in blood samples of healthy subjects have no significant fluorescent intensity. The data revealed that SFP used in the blood sample of CML patients and bone marrow sample of AML patient both got significant higher fluorescent intensity. Combine the above results, we have a better understanding of the preliminary results of SFP for MRD. Although we still need more clinical verification to confirm our theory, we are more confident to continue to develop in the future. We use mini pigs for coronary angiography. After the SFP injection, we use laser excitation light source to monitor the blood flow. We can easily observe blood flow instantly without any large equipment. In addition, SFP was made by nutrients which can be absorbed and decomposed without causing any allergic reactions. Although we still need more clinical data to verify whether this technology can really be achieved, this experiment also gave us enough confidence to continue to move towards more applications. SFP may give us more convenience in future applications. If you are also curious about these applications, please contact us. Let's illuminate the cells and lead us to new ways of curing cancer.